Hello, I'm Jordan Fred with Range Physical Therapy, and I just wanted to quickly make a video about neural tension or nerve tension in your nerves. This is something that's commonly overlooked at, especially when we start looking at muscle flexibility, and a lot of people blaming maybe tight hamstrings or a tight muscle as to why they don't have adequate or proper flexibility. I have seen numerous times where an individual may have actually fairly good muscle flexibility, but they still may present as they are not very flexible. And one major culprit to that is nerve tension. Now, quickly, just I wanted to say that if you are having any nerve tension, any pain, discomfort, I highly recommend that you go and seek medical attention to address, diagnose, and treat those symptoms or impairment. This is not a diagnosis video. This is simply informative, just to learn a little bit about nerve tension and a simple exercise to help improve the mobility of your nerves. So when you bend over to reach down and touch your toes, your nerves from head to toe need to be able to stretch about 10 centimeters. That's quite a distance, and there's a lot of things that can get in the way of you being able to properly bend over and touch your toes if your nerves are where the problem. So along the chain from the spinal cord all the way down the back of the leg, there's a lot of different areas or little things that can happen that prevent those nerves from being as mobile or flexible or stretch the way that they should. They can be caught up in some tissue, they get stuck. Some tissues, if you have scar tissue, can have some adhesions going on where the nerve just has a very difficult time sliding through tissue that it normally would be able to slide through fairly easily. So that can create a lot of different discomforts down the back of the legs, and you may not even have any symptoms, pain symptoms, for you to have tight nerves. I'm a perfect example of that. I have nerve tension, but yet I don't necessarily have pain going down the back of my legs. I want to differentiate those two things, that pain does not always mean that you have nerve tension, and nerve tension does not always mean that you're going to have pain with certain activities. So I just wanted to make that very clear. So I'm just going to quickly talk about a simple exercise for your lower extremity nerve tension. And I'll demonstrate it. Best way is lay on the ground, a nice firm table. You can do it in bed. I've done it in bed, and it works, but I think having something a little more firm tends to be a little more advantageous and beneficial. So simply laying down on your back and reaching up, grabbing one hand behind the back of your leg here, and then there are several ways that we can do this exercise, and it solely depends on where our nerves seem to be getting caught or stuck, or if they're just tight from top to bottom. So typically I will have my clients pull their toe back, straighten the knee until they feel tension in the back of their leg, usually right behind the knee, sometimes a little bit higher, sometimes just a little bit lower, but generally through this area. And then I will have them do about 10 repetitions, more if necessary, and on the 10th one, I will have them then straighten their toe and bring it back. Now the thing you'll notice if you have nerve tension is when you straighten your toe, the discomfort or the stretch feeling that you're feeling in the back of your leg back here will diminish significantly. And that's usually a very big indicator that that is what's creating that tension or discomfort in the back of the leg versus a hamstring tightness, which would not alleviate by us moving the ankle up and down. So this is probably the most common way that I teach it. And then on the 10th rep, 10 ankle pumps. Now, there's a lot of different ways, and there's a term that we use, either flossing or tensioning the nerve. So one way that we work the nerves and the nerve mobility is tensioning it. So if you think you've got a bungee cord or whatnot, and it's tight on one end or secured on one end, the other end you can pull and stretch that, okay? And a lot of times that's how we can help the mobility of those nerves. Sometimes those nerves are just caught through certain tissues, so we use a term called flossing, where we instead of keeping one end stationary and just moving the other end, we actually move both ends of that nerve. And depending on the nerve that we are going after, that's going to change the type of exercise that you may be assigned from your physical therapist or whatnot. So I just wanted to clarify that there's a little bit of difference in how we do these exercises based on what our goals are for that exercise. There are times, like I said, where your nerve is just tight and it won't stretch very easily. There are times where it's caught and we need to move it through tissues a little bit better. Now, a couple things I also wanted to mention about nerves. One is this should be a very light stretch in the back of the leg. Nerves are far more sensitive than your muscles when you've had, say, somebody stretching your hamstrings or any muscle in your body, and you feel kind of that really tight stretch. It's a little bit really uncomfortable. With nerves, we don't really push to that extent because we don't want to aggravate them, and our nerves can get aggravated fairly easily if we overstretch them. So it's a fairly gentle movement. It's very subtle in regards to how much we're tensioning, but over time, that tension, that mobility of that nerve should improve, whether we're trying to get it moving through a tissue or just stretching it. So I hope this was very helpful for you. Please reach out if you have any questions at all. Again, I'm Jordan Fred with Range Physical Therapy here in Denver, Colorado. Take care and have a great night.